pleased to be sharing my lecture today. And it's an honor to be invited to share with you this lecture today. And I was invited by my dear colleague, Professor Dr. Harhash. And first of all, I would like to thank also the supporting system with Dr. Reem Al-Habibi and the other technical support team who worked hard to present and facilitate this conference as a digital conference, one of the pioneers in the field of dentistry nowadays in Egypt. My name is Asmaa Harhash. I'm a professor in conservative dentistry. I've been thinking a lot in the last previous months about what's going on all around our profession and our educational system and our maybe time that we had to figure what's going on all around us, and how can we just make an idea of dealing with the present situation, either with our profession, our colleagues, our students, to know how to make the maximum benefit of the time and effort and the cost that we already are paying due to this situation. So the title of my lecture is Redentistry. Maybe it's an invention or it's not a term that that's present, but I would like to share with you my idea of changing the concept. Changing the concept, maybe a new perspective that I would like to all the general practitioners to take into consideration. Making redentistry maybe using of what we had in the past, and starting to see how can we change this concept and change our delivering to our treatment to our patients, and to see these results on our profession. Maybe in the previous few months, we had our stuck with the crisis of Corona, and it was very shocking that we had to change our life, and our life, social, economically, maybe even our ordinary simple things that we have to use and to do every day, because everything were shut down, everything was temporarily closed, so we were faced and forced to deal with this situation. People, even their looks changed because of a very minute, small viral infection that we still till today don't know how to deal with it, or we are trying to deal with it, and especially that we don't know when to end and when it's going to be terminated. So concerning my idea is how to make a benefit of this crisis and try to jump off these obstacles. The coronavirus took a lot of our thoughts and considerations dealing with, especially our profession, because it's dealing with the cross-infection all over. And as we know, when the world is changing, we have also to step up and keep on going with changing with this change. So this very small organism had a bigger and a wider point of view to change our mind, not just practice. the coronavirus, all over the few months, I've been attending a lot of maybe lectures, webinars, to see how that would affect us, especially the dentist. And as I say, the profession, because we deal with a lot of number of patients in our clinic in the faculties of dentistry all over the world. We had to spend a lot to protect ourselves first, and to think about the circles that may jeopardize our safety, our health. Starting from the very close circle of maybe 1 meter, with wearing a lot of things just to protect ourselves, and how that would make us deliver our treatment. Either there is a confirmation of that the patient having this virus or any disease, or not. We are dealing with a case that we have to take all our protections, the second circle and the third, including our clinic, our building, our profession all over. So we spent a lot of money just dealing with things that is not related to our maybe treatment planning, or delivering the, as I say, the conservative approach that I'm teaching or dealing with the students. So a lot of money were directed towards us to protect ourselves, using sanitizers, gloves, masks, overheads, whatever. So the cost that we took just to protect ourselves and our patients, let us say that would affect our what do you say, how much the patient would have to pay, because all this would be reflected on his acceptance to whatever you are doing to it. So the experience that we took is a lesson, and every experience that we take or share should be a lesson that teaches how to deal with the future, because of the challenge that we might face in accepting the mainstream dentistry. I mean, the general practitioners do, the patients that regularly visit our clinic. So we have to see what are we going to do. Dealing with this is coming from the past. I've been in London Museum, and I took this picture on the left side of the first dental unit. It was in 1930, and if we took a close look at it, and how the scientists tried to ease the work of the dentist by making everything available in one unit with the most simple things that you can imagine nowadays, but it was sophisticated than in the past, and how many things could change and still changing today after maybe 50 years or 100 years. So if the development of tools have changed, don't we have to change our mind? You can see in the recent units how all the companies and all the developers try to make the patient comfort and the dentist deliver his treatment with the most usable and friendly and protecting maybe devices. Also, when we have a quick look at the instruments and the tools who was also just limited to removing a tooth and just to take off the pain from the patient, to the most sophisticated devices and equipment that can make benefit of the time, the effort in one glance. And you just make your restorative dentistry or crowns, onlays, whatever, in just maybe half an hour you can deliver and bond your restoration, and the patient is happy. So can you just be influenced by this concept, by this idea? Can you be inspired by any way to how to your profession? Would you change your judgment about dealing with teeth with this concept? My main concern and my main lessons all over the years to students that they have to cherish and deliver the beneficial treatment to the dental patient with the least conservative way. And maybe this concept is emphasized nowadays because our willing to change is the concept. We should improve our communication with our patients. See how they like to express their happiness with treatment with dental treatments. Whenever you have the chance to treat the patient to the way you like to be treated, would be just few minutes to take a look and to have an idea how to make your patients happy. Because all the patients that attend to the dental clinic have a background and ideas that treating teeth is making people happy. With the pain inside also is having these distracting emotions. But the scientists all over the years were persistently seeking this or creating this marriage between the science and the emotion. What the goal is to reach this satisfaction and happiness and to deliver their expectation with the higher level represented by all the time. And as you can see in the movies and all the advertisements, that the attractive smile is connected with our profession. So to get back to our idea, how to preserve this tooth structure and retain the tooth long term is our ultimate goal. How would we do that? How we can take our old and our safe environment that we can just do as our professor said, and how did we learn our lessons that do that with this traditional and conventional way? Can we change this? Can we take ourselves from the ordinary concept and change this? I think we can, because the evidence showed with the practice that we do all over the time that dental profession has a vision towards making life more better. We can use these professions and skills to improve health by simplifying everything, but efficiently delivering the best treatment. All over the globe, we can see and read about the oral diseases that remained a high and traditionally curative model of making oral health care, but this burden is too costly, and it makes either the dentist or the patient pay a lot. So the finances, which is the question nowadays, is jeopardized by making ups and downs all over the time. So with the concept that dental diseases, especially the dental care that we are concerned with, is the fourth most expensive disease in the world. Actually, when I read that, I was a little bit shocked. I didn't imagine that we can pay a lot for a very small bacterial infection as the dental care is, as the coronavirus is making also our life turning into, I think, a hell. Especially these oral diseases which affect the children, our future, and leading to a lot of expending time and money and taking these children out of their future from learning into just treating. We have to speed our treatment and need to do it efficiently. Many advances in the restorative field by making biomaterials, clinical operative techniques, and technologies, enabling also the oral health teams to deliver the recent contemporary approaches were all done to achieve and maintain this oral health. And all the stakeholders all over the world, either healthcare, nurses, oral health, and industry partners in these industries, dental educators, all are fully engaged together in this team of improving and implementing this new mindset just to prevent and minimally treat without making our patients suffering from this disease. So I've been reading a lot about regenerating of teeth, reshaping them, and making reliving also by itself. As we just make a seed and try to implant a tree, so going into this direction that dentine regeneration, maybe enamel regeneration, where the most taken or succeeding research in the last few years. Why this was our main concern? Because we have a lot of goals. As minimizing the damaged tooth, or damaging our tooth, making outcome long-standing. Yes?
Hey, I'm reading. Can you switch on the so the
I didn't hear you.
Can you switch on the light?
Okay, sorry, I'm trying to make it. Is this good? Thank you. I'm sorry. It's already on, but I'm sorry for making this disturbance. These concepts were introduced in the conservative dentistry by 2 or 3 ways. One of them, the immediate dentine sealing and the biomimetics, where the goals of reducing time, efforts, and delivering a conservative treatment without damaging the tooth with long-lasting and aesthetic outcome, approved treatments all over the researchers, as I said before, through the few years, maintaining the health of the oral tissues. All the restorations that we use in these concepts are durable restoration and could be cleaned easily, and they make our patients come all the time to clean and to maintain their hygiene with us. The biomimetics is a concept I don't know if all of you have heard of, but it's recently introduced by mimicking the natural structure of the tooth. The latest materials, the techniques available, either by direct or indirect materials, as the composites, the ceramics, and this concept also emphasizes on prevention of the disease, like using the fluoride varnishes, using of the sealants in order to prevent the disease from spreading, to stop the cavities from occurring. All our concern is to maintain the healthy tissues as the enamel and the dentine as much as we can, to protect them from being damaged. Also, as I said, the tooth-colored restoration is the concern, and our concern also is to minimize the reduction. If I have the chance to use a direct restorative material, it would be better than indirect restoration. But if I have just like the endodontically treated teeth, I can replace the concept of using a post by using an endocrown if it's possible. We have to see also, I can just say that mimic. The meaning of mimicking يعني exactly copying from the nature, making whatever I can use from the nature. As the teeth is white, I would use a white and polished material. If the anatomy is important, so that is the concept of biomimetics. Just this was for the question was delivered. Also the immediate dentine sealing that was introduced by Pascal Manet in the recent years also was the goal of use it is to prevent post-operative hypersensitivity and to prevent contamination of the dentine and increasing the bond strength. The immediate dentine sealing concept is just to prevent any change in the adaptable cavity walls, making benefit of the collagen and the water and the structure as is. So in this concept, he uses a self-etching bonding system as soon as he just do the cavity. As soon as the tooth is also, it should be isolated to prevent contamination, but you can use a self-etching system, a bonding system, in order to keep the collagen and the integration of the tissues even through the temporary sessions that you use until you deliver the permanent restoration, either to the vital or non-vital teeth, either to the teeth that they have sensations and pulp, or the already endodontically treated tooth. Till this happens, you can use the immediate dentine sealing concept. Using of a material like the bulk fill composite to deliver it with all its improvement in just one glance or just few seconds, whenever you can minimize the time and the effort that would be going with this concept of preserving and approaching the conservative approach, using of the best of the dental curing units to minimize the time the patient that is on your unit. You know all that they say it's maximum to deal with a person for 45 minutes in order to decrease the infection liabilities or to make infection control more beneficial. So whenever you can use materials that can be delivered in just one click, to use the compules instead of syringes, that would be helpful to prevent these infections. Also, the bulk fill, as we know, it's starting to be used as the companies deliver now in the anterior also section, and it's making a lot of results, good results, because of the shades they are starting to introduce. Also, in terms of cementation of the indirect restoration, you can replace your total etch resin cement with the self-etch adhesive resin cement. The bond strength and the vast numbers of research that have been ready in the field show a very good result in using this, and it also concerned with the margins of the indirect restoration and the sealing that would start the failure. Our handling with the materials, as the use of these comfortable sectional trays that would minimize the materials used, minimize the cost, make the impressions that use in a lot of saving the cost that you take into the patient's treatment, integrating all these either by the material, impression materials, or achieving this fitting restoration, more fitting and not using a lot or wasting a lot of your resources, is one of our concerns towards this concept. At the end, I can say that this lecture is about thinking a lot of changing your mind, because as a professional conservative dental educator, I can say that the tooth is our diamond. We can treasure it. All the conservative preparations that you can use should be your first choice. If you can do a direct restoration, would be much better than the indirect, if the case is not in need of stresses or strength prevention. If you cannot use the full crown and instead deliver it with indirect onlays or inlays, overlays, either also a veneer lays, if you are used to this term, just to replace the cast tips that were attrited by time. Whenever it's possible, use the most conservative way. You have to have a good knowledge about the bonding systems and how to select the most right type that would give you a proper timing, a proper duration, a proper system according to the tissues. A lot of our colleagues do not pay attention to bonding, but I think it's the first and the most important factor in delivering success to conservative dentistry all over, either with the operative dentistry, endodontic treatments, fixed restoration. The bonding is the main and most important factor in these dilemma. Also, our cases and investigations should be documented, because as we learned, and as I hope I did deliver my idea, documentation and investigations is our way towards success and to know our lessons. Our attempts to learn for the future would be from our past. We cannot leave everything just to be, as we say in Arabic, يعني يعدي كده. We have to stop and see if this is possible. I would take all the chats in just a minute. So is it possible that you take the decision and start reaching the top, start reaching, be a professional giver with the least amount of money paid by either the patients or by you to deliver this treatment? I think this should be considered and thought about. All the new generations have a lot of promising ideas, and I think they would be encouraged to do that. Once again, this is my contacts. If anyone can share whatever or ask about anything, it's a pleasure to be with you. Actually, I don't share my cases on social media, but I would be glad and pleased to give you any advice, if you like, through these contacts. And eventually, thank you for your time and your invitation.
Questions?
Yes.
One is asking about the meaning of the
Breaking index for class 3.
First one is asking about the
yes. As I said, biomimetics means to mimic. Mimic means يعني ان احنا نقلد, to copy milling.